The construction of a proposed Ebola facility in Kenya, specifically in Laikipia County, has sparked public concern, with it renewing scrutiny of a 2015 health deal signed between Kenya and the US. In this episode, we examine different angles of how the agreement is shaping national conversation. The debate over the proposed Ebola isolation facility has revived attention on the Kenya-United States Biosafety and Biosecurity Cooperation agreement signed on July 24, 2015. The agreement, signed by the then Health Cabinet Secretary James Macharia and then US Ambassador Robert Godek, focuses on strengthening cooperation in biological threat, disease surveillance, public health preparedness, and outbreak response. While it does not explicitly provide for the construction of an Ebola facility, critics argue that its provisions form part of a broader framework that could support future disease preparedness and health security infrastructure.
Mtu mwenye alisign mambo ya Ebola kuja Kenya ni Uhuru Kenyatta. Haida ulisema na huyu mtu yake principal wake. Kwa sababu Uhuru Kenyatta ya sponsor huyo Sifuna. Hiyo timu yao inaitwa sijui ati Sifuna kitu gani. Linda ground ya mama yako.
The agreement was later renewed in April 2022 by then Health Cabinet Secretary Mutahi Kagwe and US Eric Nidler, extending cooperation through 2029. The renewal has since been referenced in the ongoing debate, with some political leaders and members of the public questioning whether the proposed facility is linked to broader Kenya-US health security cooperation. In the United States, President Donald Trump has in past remarks taken a hard stance on Ebola, saying that the disease should not be allowed into the American territory and emphasizing strict containment and border protection measures during outbreaks.
We cannot and will not allow any cases of Ebola to enter the United States.
His comments are now being revisited online, discussions surrounding global Ebola preparedness policies. Back home, President William Ruto has responded to concerns over the proposed facility, stating that his approval was based on Kenya's long-standing partnership with the United States in health cooperation, which noted has existed for several decades.
Partnership with our friends, the American government, is a partnership that is mutually beneficial to us and to them. When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay because it was an agreement and a partnership with friends who have worked with Kenya for 30-40 years.
The president emphasized that such collaborations are part of strengthening Kenya's capacity to respond to global health threats and should not be misinterpreted as evidence of an immediate outbreak risk. However, the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has issued a strong statement calling for the project to be halted or fully reconsidered. The doctors' union argues that if such a facility is established, then healthcare workers deployed there must be adequately protected and highly compensated, citing the risk associated with handling highly infectious diseases. The union has also called for greater transparency and consultation before any implementation proceeds. Health officials meanwhile maintain that preparedness infrastructure is a standard part of modern public health systems and is essential for early detection, isolation, and response to infectious diseases. Ebola is a severe viral disease caused by the Ebola virus, transmitted through direct contact with infected bodily fluids or contaminated materials. Symptoms of Ebola include fever, fatigue, headache, muscle pain, vomiting, diarrhea, and in severe cases, internal and external bleeding. Medical experts say early detection, isolation, and rapid response remain the most effective tools for preventing and controlling outbreaks. For now, the construction of the Ebola facility remains part of the national debate, with competing perspectives of its risks and purpose. Christabel Njeri, and this is PMTV.